We're now being joined on the News at 10 by a Professor of Virology, Professor Tomori. Thank you for joining us on the News at 10. Professor, some Nigerians still have concerns about what they describe as possibly negative effects of the COVID-19 vaccine, what it might have on their health. Now, in a country where some people in the past rejected the polio vaccine, how will government convince such people on the safety efficacy of the vaccines?
Thank you very much. I think one of the first things to think about is that over 20 million people have been given this vaccine in other parts of the world, and we have not had any adverse effect or people dying. So that should give us some kind of confidence about it. The vaccine that they have in mind, I think one of the best ways for us to get as many of our people, public people, to get involved and make use of that, be given those vaccines and do it publicly so that people will be convinced and say that nobody is running away to get a different kind of vaccine. It's the same vaccine that I'm going to get, that my president got, that my head of state or Senate president, minister got. That way you're going to convince your people by showing public example as role models.
What's your take on the government's vaccine deployment strategy, starting with the health workers, frontline workers, government officials, the elderly, those with comorbidities in that line?
I think that will achieve quite a lot of things. First of all, the first line of defense are the health workers. They're the ones who meet all the cases. So we need to protect them. Otherwise, if our health workers are not there, then we won't have anybody to take care of us in the hospitals. Then you look at the group, they're also talking about government officials. I actually mentioned that already. If you get the public figures to take that thing, it's going to convince more people of the need to take it. And finally, by the epidemic of the disease, a lot of the people who are dying from the disease are the older people. So you need to protect them. So that distribution rollout plan was based on so many combinations of many things. First, the epidemiology of the disease. Secondly, to address the hesitancy amongst Nigerians to convince them that this is safe, and also what we said about the health workers being the front line of defense. We need to protect those people. So those 3 points were taken into consideration in rolling out that plan.
Professor Tomori, in about 30 seconds, you've always said the vaccine's coming. It's not necessarily the solution. We still have issues with adhering to the non-pharmaceutical protocols. Do you see any challenge, and how do you think we can surmount it?
I think we need to conclude telling people that the vaccine is not the solution. The solution is to stop the transmission of the disease. The vaccine will protect you, no doubt about that. But we must stop the spread of disease. It is this spread that is leading to the variants. And if we have more variants, even the vaccination will be a problem. So let's keep on with those steps, non-pharmaceutical interventions to ensure that we don't spread this virus and it doesn't give it the opportunity to create more variants for us.
We appreciate your time on the program, Professor of Virology, Professor Tomori. Thank you for joining us on the News at 10.
Thank you very much. It's my pleasure.